home blood pressure monitoring and its importance. Now, first of all, we need to know a little bit about hypertension. What is hypertension? Hypertension basically means a raised blood pressure of the body. Now, hypertension is considered a major modifiable risk factor in India and contributes to one of the top causes of death in our country. Now, therefore, the measurement and control of hypertension becomes paramount in preventing diseases like heart attack, stroke, and kidney disease. A good thing is this hypertension can be controlled and prevented by many such measures. Importantly, like control of obesity, reducing your body weight, decreasing physical inactivity by becoming more active, reduction in salt intake, and decreasing the amount of alcohol intake. Now, hypertension is a disease whose diagnosis can be accomplished non-invasively, and that doesn't require frequent laboratory assessment like other diseases. Therefore, diagnosing it and treating it becomes much easier compared to many other diseases that we encounter. Now, essentially, in the last few years, there have been many digital devices available in the market that can very appropriately record the blood pressure of the patient and give a very good heads up regarding any disease that's present, thereby rather enhancing the ability of the clinicians to diagnose the patient. Now, coming to the measurement of hypertension. As I said, there are many digital devices available in the market. They are all properly standardized according to the international protocols and with the appropriate cuff size, that is the cuff that we use to measure the blood pressure, a very good reading can be obtained. Now, one of the primary requirements before that is that the patient should be relaxed enough. He should be in seated position and the arm should be at the level of the heart. The legs of the patient should be uncrossed. Now, the importance of that is that if you keep the legs crossed in these patients, the diastolic blood pressure tends to rise a bit. So in order to prevent any discrepancy, we have to keep the entire body relaxed and the legs uncrossed. Now, in our country, we generally diagnose a patient with high blood pressure when the blood pressure is found to be 140 millimeter or more in systolic and 90 millimeter or more in diastolic. The diagnosis is usually based on two sets of tests that are taken 1 to 4 weeks apart, depending on the patient's condition. However, there are situations where we cannot wait that long, like patients who are presenting with heart failure or hypertensive emergencies. And in those situations, it should not be waited for that long. Now, it is advisable by the country that all adults above the age of 18 years should undergo opportunistic screening by healthcare providers, as due to our hectic office and home lifestyle nowadays, most people miss out on detection of high blood pressure. It has become so common that many patients come to the clinicians directly with the complications rather than being for the first time diagnosis. Hence, it is very important to get checked up. Now, home blood pressure monitoring devices in this sense are very much useful for the patients. How? See, post-COVID, the outside visits have become less and less. We cannot meet other patients. Even visits to doctor have been limited much. In such scenarios, to detect one with blood pressure or simply for screening purpose, it is very essential to have a home blood pressure monitoring device for the first timers as well as those who are already known to have hypertension. Now, there are certain advantages of having a home blood pressure monitoring system. For example, it is good for the patient because it's much easier for them to use. Since it's a digital machine, there is no need to go for auscultation. They can get the recording simplistically from the machine itself. And the results of this home blood pressure monitoring are at par with the measurements that are taken into the doctor's office. Now, for us doctors per se, there are certain specific indications for home blood pressure indications. Two such conditions that come to mind are white coat hypertension and masked hypertension. Now, what do we understand by those? White coat hypertension is a condition where, simplistically speaking, when the patient visits the doctor, he has a raised blood pressure. When he is at home, his blood pressure is normal. In other words, seeing the doctor itself gives him a hypertension. Now, we may think that this is a normal condition. Seeing a doctor is a stressful job and therefore BP might rise or not. But it has been found that white coat hypertension usually turns into full-blown hypertension in the coming years. And therefore, even white coat hypertension diagnosis is important. In that sense, the home blood pressure monitoring becomes important. Second condition is the masked hypertension. In this condition, when the patient visits the doctor's office, the blood pressure is found to be normal. However, when he is at home in a more relaxed situation, his blood pressure seems to be high. Both these conditions, the masked hypertension as well as the white coat hypertension, lead to full-blown hypertension in the future. Therefore, home blood pressure monitoring becomes paramount. It is a very good adjuvant to office blood pressure measurements. Now, what are the benefits for the patient? One of the major benefits is that you can take multiple readings of blood pressure in a day, and it can be measured whenever you want, simplistically speaking. The readings are stored, therefore there is no idea of losing the paper or something. They'll always have the reading with them. Then conditions like white coat hypertension and masked hypertension can be diagnosed quite easily. That is away from the clinic setting, so it's comfortable for the patient as well. Another advantage is that the results that we get from home blood pressure monitoring are at par with the other office-based measurements. So there is no discrepancy in a home and office-based blood pressure measurement. And last and most importantly, compliance of the patient, because it is often difficult for patients at current day and age to take out time and visit the doctor's office continuously. So in that sense, using a home blood pressure monitoring device at home becomes easier for them. They can easily get it done and they can check their blood pressure. As well as for those who already have hypertension, they can monitor their blood pressure response to drugs and alter the drugs accordingly. It is a very useful and important tool in the routine management and control of hypertension. Therefore, it is our advice that patients and other people who are not patients yet but having a stressful lifestyle, they are having a hectic schedule and whatnot, they are at risk for hypertension. They should get educated. They should understand how to use the home blood pressure monitoring devices. These devices are easily calibratable. So once they get to use the devices properly, they can measure their own blood pressure. And this in turn, in the long run, helps the patient in preventing many serious diseases.